We're talking with Dr. Lynn Butterly, the director of colorectal cancer screening at Dartmouth-Hitchcock, about preventing colorectal cancer.
My name is Lynn Butterly. I'm a gastroenterologist and director of colorectal cancer screening at Dartmouth-Hitchcock. And I am also the principal investigator and medical director for the New Hampshire Colorectal Cancer Screening Program, or NHCRCSP, fondly known as the CRISP, and the PI of the New Hampshire Colonoscopy Registry.
And PI means principal investigator?
Yes, it does.
My first question then is a pretty general one. What is colorectal cancer?
So colorectal cancer is a cancer that forms on the lining of the colon or rectum. The colon is the large intestine. And the end of the large intestine or colon is the rectum, then followed by the anal canal, and that's where the stool comes out. So we are looking at the large intestine for a growth or cancer that might form on the lining of that large intestine, and that is what's known as colorectal cancer.
How common is colorectal cancer?
It is very common. Colorectal cancer is the second most common cause of death from cancer in this country. It is the third most commonly diagnosed cancer in men and women. And if people did not smoke, in other words, if lung cancer weren't the most common cancer, then more people would be dying of colorectal cancer in the United States than any other cancer. So it is common. People have an approximately 5 to 6% lifetime risk of developing colorectal cancer.
So would it be fair to say that it's a fairly serious form of cancer?
It is, particularly if it's not caught early. And as with many other cancers, it is most important to try and catch a cancer at an early stage before it has spread, because that definitely increases our chances for effective treatment and also for long-term survival. So, for example, if a colorectal cancer were caught early, then there might be a 90% 5-year chance of survival. On the other hand, if it's caught late after it's spread, one might have a less than 10% 5-year survival. So how early you catch it makes a big difference for colorectal cancer, as for many other cancers.
How does it actually develop, colorectal cancer?
So the way colorectal cancer develops is a bit different than some of the other cancers, in that there is what we call a precursor lesion. In other words, a small growth called a polyp that over many years has a chance to turn into colon cancer. So a series of genetic mutations might allow a small growth or polyp on the lining of the colon. And then over a period of 5, 10, or maybe 15 years, additional genetic mutations allow that polyp, some of the polyps, to turn into colon cancer. Very few polyps actually turn into colon cancer, but on the other hand, almost all colorectal cancer starts off as a polyp. So the fact that there is this growth known as a polyp that will take many years to become a cancer gives us an ideal opportunity to look in the colon, find the polyps and remove them so that they no longer have a chance to turn into cancer, the so-called polyp to cancer sequence. We can interrupt that, and that is one of the most compelling reasons why colorectal cancer screening is so important, because we can find the polyps and remove them, and in that way prevent the cancer altogether.
By getting a colorectal cancer screening, it sounds like people are able to prevent a cancer. Can you talk a little bit more about preventing colorectal cancer?
Absolutely. So as we were saying, by finding polyps and removing them, we can prevent many cancers from developing. There are two major goals in screening and in colorectal cancer screening in particular. One is early detection, which was finding the cancer early that we touched on earlier, and the other is prevention. So, for example, when a person, usually a woman, has a mammogram, we are hoping to find cancer as early as possible if there is a cancer. We're hoping there's no cancer, but if there is one, we definitely want to find it in the earliest possible stage because our treatment is more effective and survival is better. So that's what early detection is about. It's finding the cancer early to prolong your survival. On the other hand, in colorectal cancer, because of the polyp to cancer sequence, we are able to not only find cancer early, but also to prevent it altogether by doing a colonoscopy, finding and removing polyps, and thereby preventing the cancer from ever forming in the first place. So there is early detection, but even more compellingly, if we can, prevention is what we're really after. And in fact, one of the things that patients and providers often find very reassuring about this is that when we do colorectal cancer screening at an appropriate age, which means, as we'll talk about later, that if you have no family or personal history, you start at 50, not at 75. But if you come at the appropriate age or close to that, your chances of having colorectal cancer found on that exam are extremely small. So it is a rare thing to find a colon cancer. It's not impossible, but it's rare, on a screening exam done at an appropriate age. It's probably in the vicinity of 0.1 to 0.2% of exams. On the other hand, polyps are very common, and that would be somewhere in the vicinity of 40% of people. So that is the beauty of screening. If you come at the right age, you're very unlikely to have anything bad, such as a cancer. And furthermore, if you have a polyp, we can remove it and thereby potentially prevent you from ever having colon cancer.
Is this one of the few cancers that can actually be prevented?
Yes, there are a few other cancers for which prevention is effective, but colon cancer really stands out in that way because of this distinctive polyp to cancer sequence. So any cancer that has a precursor lesion that we can find and remove before it becomes a cancer, that opens up the opportunity for prevention, and colon cancer is a classic example of that.
So that feels like it makes a pretty compelling case for getting colorectal cancer screening because it's a very serious cancer, it's very common, but it's preventable.
Absolutely.
What is involved with a colorectal cancer screening? Do you just show up and a half an hour later you drive yourself home?
Well, that would be nice. Well, hopefully we'll get there one day. But right now, so the two most common forms of colorectal cancer screening at the present time would be fecal occult blood testing, which I know we'll get into in a little more detail later, and colonoscopy. Fecal occult blood testing is a test that's done at home. You're given cards and instructions on how to use them, and those are sent back into a lab and developed. Colonoscopy, which is the most commonly recommended test at the current time, is a test that sees the entire colon and rectum. So it sees the entire large intestine, colon and rectum, and has the ability to remove polyps if they are there. There is no other screening test that allows you to remove polyps if they are there other than colonoscopy. However, you can't just show up and say, here I am. As we all know, there is a preparation, because when we look inside the colon, we have to be able to see the walls of the colon where the polyps might form. And so the colon has to be cleared of any stool or food debris or anything else that might be there that would obscure the view. The prep is said by many to be much harder than the test itself, and that's why there are tips and tricks to make that easier for people, because it is so important in terms of allowing us to see. It is certainly easier to take a prep than to have colorectal cancer. And so there is a prep. Oftentimes sedation is used, medication to make people comfortable for the exam, and therefore they need a ride home because someone else needs to be doing the driving. So that would have to be set up ahead of time. And so it's something for which people receive specific instructions. They know when and where to show up. And if they follow those instructions, it's usually a simple and fairly straightforward type of procedure. You do go home the same day. After the test, people usually stay at the facility for variable but short amount of time. When we see people are ready to go home and have their ride there, then off they go. And that's usually all there is to it. And if you don't have anything that would cause you to have the test early, in other words, a few months later, which can happen in certain settings, it would usually be 5 to 10 years before you need to come back. So people always love to hear they're on the 5-year plan or the 10-year plan, and that's a nice long break before you need to do it again.
What are some of the reasons you hear for why people don't do colorectal cancer screenings?
Well, you can hear a whole assortment of things why people might not want to do a screening, in particular a colonoscopy. But some of those reasons would be the preparation ahead of time can seem a little daunting. For that reason, most prep instructions that one would get from the endoscopy site itself, in other words, from the place where you're going to go for your test, tend to be fairly detailed and help you through that. There is also one or more videos, one of which is on YouTube that tells you tips and tricks for how to do the prep to make it manageable, so you can, rumble and grumble, but it's really a doable thing. And thousands, millions of people every year are able to get through it. So I hope that offers some encouragement to people. And needing a ride home can occasionally be a problem, but there are ways that the endoscopy site will try to help with that. And given the head start that we usually have, for many people, it's possible to find someone who will just give them a ride home. Another very major barrier for some people is lack of insurance, and in particular for low-income uninsured people, that can pose a real barrier to any medical care and certainly to a colonoscopy. So we are very happy that there is now a CDC, the Centers for Disease Control, CDC-funded grant program in New Hampshire called the Colorectal Cancer Screening Program, CRCSP, or CRISP, as we said earlier. And through the CRISP, we are not only increasing colorectal cancer screening throughout the state, but we are able to provide a small number of free colonoscopies throughout the state for low-income, uninsured individuals who live in New Hampshire and who are having screening. One can have had a polyp before, that's fine, or a family history. There are certain criteria for eligibility, and people who would be interested in finding out if they would be eligible can call the CRISP. The number is 603-653-3702, and then the CRISP personnel would determine eligibility, would pay for the preparation, a visit with a primary care doctor if that's needed beforehand, and the colonoscopy. And our clients are guided through the program by nurse-patient navigators who explain what's going on and how to take the prep and where to go and the follow-up. So that's been very successful, and we're really delighted to be able to bring that kind of a service to New Hampshire.
So aside from the people who haven't taken advantage of that program and have trouble affording a colonoscopy because they don't have health insurance, what would you say to the folks who don't have that excuse about a reason to take a screening test?
Right. So you're saying now people who are insured.
People who are
right,
insured.
And don't have that as a reason. And let's not forget the Affordable Care Act, which is helping with all of this as well. I think that the major thing to keep in mind is that there are only a very few cancers that can actually be prevented. Going through a colonoscopy or any other screening test is guaranteed to be easier than going through colorectal cancer. And because of this really tremendous opportunity that we have to find the polyps and remove them and prevent people from ever getting colorectal cancer, which, as we said, is the second most common cause of death from cancer in this country, I think it makes an extremely compelling case for people to talk to their primary care providers about screening and pick the test that's right for them, because it's something that truly can protect your health.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.